Good morning, good afternoon, and good evening to all joining us from across the globe. On behalf of the Prevention of Harmful Practices team, in collaboration with Child Protection System Strengthening team in UNICEF, I'm delighted to welcome you to this important webinar on disability inclusion in child protection programming with a specific focus on ending harmful practices such as female genital mutilation, FGM, and child marriage. My name is Shaohua Wang, and I serve as the Child Protection Officer at UNICEF. I'm joined today by subject matter experts, program specialists, and passionate advocates from across the movement who are working to ensure disability inclusion in child protection. This session is part of our ongoing webinar series aimed at strengthening cross-sectoral learning and collaboration on disability inclusion within child protection. Today's agenda brings together global and country-level perspectives, starting with an overview of the guidance brief on disability inclusion from UNICEF's Child Protection Specialist on Disability Inclusion, Lucy Richardson, followed by a presentation from Dr. Jacinta Muteshi, the team lead of the Girls' Generation, supporter to the Africa-led movement to End FGM. We are also excited to hear from UNICEF and UNFPA program specialists in Mozambique, who will share their experiences and the lessons learned from implementing disability-inclusive approaches in ending child marriage programs. We encourage you to actively engage during the Q&A session, and we look forward to a rich exchange of ideas that will help us collectively strengthen our work. Thank you once again for being here. Let's begin with a brief icebreaker. Now over to my colleague, Arunav.
Hi, everyone. So I hope you can see my screen. Sorry, just a sec.
Yes, we can see. It's loading, but we can see.
Oopsies. Okay. So we have prepared a very brief Mentimeter, which is sort of, we have a few questions around some of the questions and some of the topics that we will be discussing today. So if we can just spare a few minutes doing this fun quiz that we have curated for everyone here. So please feel free to scan the QR code here. And then I will begin in less than 30 seconds. Let me see if anybody, okay. We're still getting. Okay, let me quickly begin the quiz. Okay. So okay, I'm seeing people are still joining. Let me give 10 seconds more. Okay, let's begin. Okay, so question number 1. What do you think are some key drivers of harmful practices for children with disabilities? One is stigma and discrimination against disability and gender. Oops. Inaccessible prevention, response services, higher rates, all of the above. Okay, majority went with all of the above. That's the right answer. Let's go with the next question. Shao, I hope it's coming correctly. Let me know if there's any problem.
Yeah. Please go ahead. Yeah.
Thanks. Okay. Do you think children with disabilities are affected by harmful practices compared to children without disabilities? And the answer is Yes, they are affected just as much or even more. Thank you. And then now we can go with the final question. Which of these things can help make an activity more inclusive of children with disabilities? Is it A, holding in a building that has a flat entrance, providing information that is written down, organizing transport, all of the above? Yeah, and everybody has given resoundingly correct answer, all of the above. Yes, that was a brief icebreaker that we had prepared for all of you. Thank you, and we can now proceed with the presentations.
Thank you so much, Arnav. I think, am I first up? Yes?
Yes, please go ahead, Lucy.
Great. So welcome, everyone. As mentioned, my name is Lucy Richardson. I'm a disability inclusive child protection specialist at UNICEF headquarters. So I always like to start with a brief introduction to who are children with disabilities to make sure everyone's on the same page. So children with disabilities, I have the definition on the slide here as outlined from the Convention on the Rights of Persons with Disabilities. And it says that persons with disabilities are those people with impairments, which in interaction with barriers prevents their equal participation in society. So impairments are difficulties with functioning related to body systems and structures. So there's many types of impairments and they impact different areas of functioning, things like seeing, walking, learning, or communicating. So we have a photo on the bottom left of a boy with a physical impairment who has an upper limb difference. Barriers, those are the things preventing full participation and inclusion in society. Physical or environmental are things like stairs with no ramps, as in the photo in the center. Attitude, like stigma and discrimination. Communication, like lack of accessible formats. Digital, and systems or institutions. And finally, participation simply means that children with disabilities are fully included and involved in their community and environment, the same as all other children are. So we have this photo here of children with and without disabilities and an inclusive playground. Next slide. So how many children with disabilities? There's just a world map here showing that globally there's almost 237 million children with disabilities. That's around 10% of all children. And then the numbers vary greatly across the regions. But the majority of children with disabilities are in low and middle income countries where there are environments with multiple barriers which heighten the impact of their impairment. Next slide. And the other thing to know is that children with disabilities face the double challenge of having an increased need for child protection, but also a decreased access to child protection. So facing things like exclusion and isolation, higher rates of violence, and then decreased access because of inaccessible services, laws and policies, and lack of training for workers. So on to the next slide. I'll talk now about the guidance brief that I developed for the prevention of harmful practices and disability inclusion. So on the slide here is just a quick overview of what's in the guidance brief, addressing both child marriage and FGM, and how to act with disability inclusive programming for both of these. Now, this is targeted towards our partners working in the global program to end child marriage, as well as the joint program on the elimination of FGM. So it's really targeted to that work, but of course we can share this, this guidance brief with participants afterwards. So next slide. So some of the things the guidance brief covers, first of all, is the drivers of child marriage and FGM for children with disabilities. So there's not a lot of research specifically on these topics, but available evidence that we have does indicate that the drivers of these practices are similar for children with and without disabilities, along with many drivers being more severe for children with disabilities. There's also a direct link where disability can be an outcome of FGM, and it's also linked to child marriage in that early pregnancy linked with child marriage carries higher rates of complications that can lead to impairments. There's also the issue of girls with disabilities who undergo FGM may have complications directly related to their impairment and have their disability exacerbated. So some of the key drivers are listed on the slide here. So things like limited access to inclusive education. So they're missing out on services delivered through schools. They're less likely to be have their births registered, higher rates of family separation and placement in institutions, higher rates of GBV. Children with disabilities are more impacted in humanitarian and crisis and displacement contexts. And they're more likely to be isolated from the community, so have less access to the community. And poverty and limited resources are a really significant factor. So there's higher rates of poverty for children with disabilities and their families. There's the high cost of disability needs. And then the issues of where families want to recoup the high costs of disabilities through dowries, or try to offset costs, or try to secure their child's future through child marriage. And then damaging sociocultural norms and beliefs relating to disability and to gender and to age, being a child. Next slide. So a little more on the sociocultural norms and beliefs. So it's often related to that stigma and discrimination, which is, the negative beliefs and attitudes about disability itself and about persons with disabilities that combine and overlap with norms and beliefs about gender as well. There's, again, not as much research on this topic as we would like there to be, but we can certainly look at existing knowledge on these norms and beliefs related to girls with disabilities and those related to FGM and child marriage to propose how these could be interacting. So some of the key ones to do with desirability as a candidate for marriage, being perceived as a less desirable candidate for marriage, which can then cause families to try and seek out early marriage opportunities. And then that can link with FGM as well in attempting to improve desirability as a candidate for marriage. The gendered roles, both for girls and boys, to do with caretaking or to being head of the household. Beliefs about disability and having a family or having sexual relationships can influence things, and beliefs about a person's value or worth and capacity or capabilities. There's also the cause or origin of disability. There's often beliefs about disability being related to curses, to negative things that the family has done in the past, that kind of thing. And then there's also beliefs about bodily autonomy and disability that influence things as well. Next slide. So the key things to remember in disability inclusive harmful practices, prevention of harmful practices programming, I've listed on the slide here. So firstly, it's that women and girls with disabilities are at risk of experiencing FGM and child marriage and the associated harms. So it is important that the programming is disability inclusive. Second, that women and girls with disabilities will experience the same but also additional harms as their peers without disabilities. Thirdly, that women and girls with disabilities have the same rights as their peers without disabilities. So that's bodily autonomy, making their own decisions, choosing whether or not to have a relationship, and of course, protection from all forms of violence, including harmful practices. And finally, that they're the experts in their own lives. So they need to be involved in decision-making, in consultations and in dialogues. And a really great way to do this is through the organisations of persons with disabilities, OPDs. And these are simply organisations or associations that are led, directed and governed by persons with disabilities themselves. And so on the next couple of slides, just a few things that I'll go through on approaches to disability inclusive programming. So this has a little diagram here about steps you can take based on identifying and addressing barriers. So I mentioned that in the definition. So, first, if you look at attitudinal barriers, you can address things like harmful beliefs and unconscious bias in services or in workers, as well as in the community. If you look at communication, you can address things like inaccessible communications in or during the service, as well as about your service or program activity. And then in the environment or physical environment, you can look at your buildings and venues. You can look at transport or surrounding environment. There could be barriers in those aspects. And in systems or institutions, the lack of services or programs or activities, having policies and procedures for disability inclusion, that's another barrier, as well as more broadly community or national policies for disability inclusion. Next slide. We can also take the approach of leveraging opportunities for inclusion. So in the stage, this is another diagram on the slide outlining this. So in the stage of designing the program, you can look at involving children with disabilities and OPDs and other disability actors in your consultations. You can include information that is specific to children with disabilities and their rights and their needs and their experiences. In communication materials, you can have your multiple formats. So that's as simple as having, say, audio and video options for phone numbers, having flyers that are printed and emailed. You can also use specifically accessible formats, so things like sign language and large print and easy read. And then in delivering activities, make sure you've got an accessible physical space, looking at things like good lighting, seating, space to move around, and accessible digital spaces. So having captions, having sign language interpreters, having both written and spoken information in your presentations. And then finally, with partners, look at identifying your local disability actors, so the OPDs, but also less formal groups like youth groups, disability-focused services, schools, and you can also coordinate with other sectors and services for children with disabilities like social protection, education, and peer support groups. So all of this is in the guidance brief, and I think that people will find it really helpful in trying to implement disability inclusion. Thanks.
That is wonderful. Thank you, Lucy, so much for creating and sharing the highlights of the guidance brief, which we will include and share with everyone after the webinar. Now, we are going to invite another expert. So it is our pleasure to invite Dr. Jacinta Muteshi. She is the team lead of the Girl Generation Support to the Africa-led movement to end FGM. Today with Dr. Jacinta, she will share insights and also a very lively part for now. So with no further ado, please, over to you, Jacinta.
Thank you very much for that introduction. Yes. So listening to Lucy's presentation, which highlights and outlines, how does one do this work? The program that I lead is going to share with you how we've actually done this work, how we ensured inclusions of persons living with disabilities in the End FGM movement. Next slide, please. So maybe first, a little introduction on who we are. So the Girl Generation Support to the Africa-led movement to end FGM, acronym TGG-ALM, is a consortium. It's led by Options Consultancy Services, where I work, and our partners include MREF Health Africa, ActionAid, Orchid Project, and the Africa Coordination Center for Abandonment of FGM, and the University of Portsmouth. It works closely with the Population Council's Data Hub, which is the program's data and measurement arm. Because really to do this work, you want to be sure that you're being informed by research, what you're learning, as you seek to intervene really in the lives of people. This program is building on the foundations of the first 5-year investment, which was, again, called the Girl Generation, but with the Evidence to End FGM research program that ran from 2014 to 2018. So phase 2, which we are currently in, and known as the Girl Generation Support to the Africa-led movement to end FGM, is building on phase 1. And sorry, there's lots of information coming in at the same time. Is building on the foundation of phase 1 and strengthening the evidence base of what works and what does not work to reduce or end FGM in affected communities. The intended impact of this program is an accelerated reduction in the practice of FGM in focus countries. And our focus countries are Kenya, Ethiopia, Somaliland, and Senegal. And even though we do operate in those 4 regions, important to point out that we are working in those areas that are considered hotspots, so informed by the research. Next slide, please. The vision for the TGG-ALM program is a world where girls and women can exercise their power and rights, have expanded choice and agency, and be free from all forms of violence, including FGM. And this really resonates with what Lucy shared a few minutes ago. Next slide, please. So the program called TGG means that our work is very girl-centered. But to do girl-centered work, which implies and demands that you are centering the voices, needs, and priorities of girls in ending FGM, also means that you have to think about how do you work safely with girls? How do you create the kinds of platforms that would be supportive of the inclusion of girls in this work to end FGM? FGM primarily impacts girls, including girls who are living with disabilities, as we heard earlier. Girls are therefore part of the solution because they're best placed to share with us their environment, the risks they face, and the opportunities they seek. So the program seeks to ensure we're empowering girls by providing them with the necessary resources, opportunities, and support systems so that they thrive to reach their full potential. And note that I use the word to thrive because it's not enough to survive. The ethical commitment is how will they be positioned to thrive in the communities and regions in which they live. So we are providing platforms for girls to participate in their own agency. Next slide, please. So why does inclusion matter? There is often an assumption that girls and young women living with disabilities are not at risk of FGM. But I think as we heard earlier, and I reiterate here, indeed, girls with disabilities do face the risk of FGM, and more so because their agency and autonomy is often denied, and more so because harm and violence is very exacerbated for girls with disabilities. The challenges, the constraints, and the obstacles they face were already outlined. I'm not going to repeat them here. But what it says is that we need to be clearly understanding the context in which disability is occurring if we're to be able to respond. What we're also learning as we work with girls with disabilities is that some girls and young women actually become physically disabled as a result of FGM. So they're not necessarily, to start off with, girls with disabilities, but then become disabled as a result of FGM. The other thing that is important to highlight is that the people with disabilities remain very invisible, and especially in our work. So while many organizations and programs often say we must leave no one behind, we continue to see gaps in the data, and often what this means is we do not know who or where the persons with disabilities are. We do not fully comprehend or understand what would it mean to address the needs of a girl who has experienced FGM, who's at risk at FGM, if the girl has disabilities. So this lack of knowledge results in their needs often being overlooked, their voices unheard, and their rights unmet. Next slide, please. So our approach, what does it look like? 5 things to highlight here. First, let me say we have a granting program at TGG ALM as one of the ways in which we seek to empower, to ensure inclusion, and also as a way of recognizing that it's people themselves, and in this case, girls, who can determine what their lives need to look like, who can determine what interventions would work well, who can determine and help us all collectively understand how do we address these risks. So our granting program tends to be a very inclusive one. It has an advisory committee that determines who will be the recipients of grants. And we have ensured that that advisory committee includes persons living with disabilities in the communities in which we are working. And this has strengthened inclusive decision-making, and it has ensured that communication does reach disability-led organizations. So that's one. The second approach to how we work on inclusion is we seek to remove barriers that would hinder access to funding opportunities. So besides the Grants Advisory Committee, we're also ensuring that our grant-making process itself is accessible so that disability-led organizations can easily apply, and access grants. Currently, we have 4 grantee partners, and these are spread out in Kenya, Senegal, and Ethiopia. And they're demonstrating progress in removing these barriers. And some of that information is now actually documented and available for sharing. Our third approach is capacity strengthening. And what this means is it's not enough to just simply hand out resources. It's not enough to simply say, yes, we're including not just girls, but also those with disabilities. But it also means paying attention to how do we strengthen their capacity to not only access resources, but also manage those resources, implement those programs, tell their stories, develop policies and systems within their organizations that also address their needs. So, for example, one of the things that we are very pleased about, particularly not just with girls living with disabilities or organizations that deal with issues of disability, but all organizations that we grant, that they strengthen their safeguarding policies. And we give advice and support on how that would look like in terms of moving forward. The fourth approach to inclusion for the TGG program is that we also encourage and support disability-led organizations to design and implement their own strategies. This is a way of ensuring that solutions are indeed rooted in their lived realities, their community knowledge, and the priorities of those communities. And the fifth and final approach is around voice and visibility. And what this essentially means is the TGG program has been positioned to amplify those voices of people living with disabilities because we facilitate and create the platforms that are enabling of sharing stories, of strengthening leadership, of ensuring that the solutions are indeed the solutions of the organizations that support people with disabilities, persons with disabilities, and we are working at various levels, local levels, national levels, as well as regional levels. Next slide, please. So what are we learning? There are very many powerful lessons, I think, to share here. And again, these are documented and they're available for us to share with everybody who's here and with also other partners that may not have joined us today. What we are learning is that it is really important to recognize the intersectional risks. In other words, girls and young women living with disabilities face a heightened risk of undergoing FGM. So this means that our interventions must be tailored and targeted. Secondly, that understanding disability as an outcome of FGM, as I said earlier, it isn't just that these girls with disabilities, but that FGM itself can also be disabling, right? In other words, disability as a direct result of FGM. And this, of course, underscores the urgent and diverse need for prevention, as well as survivor-centered care. In other words, both prevention and response. Intentional programming. Inclusion does not happen by chance. It really does require deliberate and intentional programming that addresses those very unique needs. Budgeting for inclusion from the start. Inclusion has specific financial implications that can involve everything from ensuring safe travel with support persons, interpretations into sign language and braille. All of this must be factored into the program design and budgets from the onset. This is what we are learning, and this is what we seek to do in our own program. And finally, we're learning also so clearly and very powerfully that their voices do matter. Inclusion goes beyond participation, not just simply you participate, but it's about ensuring meaningful representation, meaningful engagement. So we've amplified the voices of girls and women with disabilities by creating spaces for them, even in key events such as Zero Tolerance Day, Under Her Voice Matters, that will happen in 2024, 16 Days of Activism Against GBV, as well as taking part in all national and regional convenings where it's possible to amplify voices, as well as through documentation and ensuring safe storytelling platforms and webinars also, which have become a mode of ensuring learning is also happening. So I think on that note, I would like to now share a very brief video, just 3 minutes, on what we are learning from working and supporting inclusiveness. Go ahead, Arunaf. Sound.
Great. There's no sound, so Arnav, maybe you can unmute yourself. I think that would do it. Let's see.
Kwa majina naitwa
Yeah,
Hibo Salat.
good.
Nimetoka kutoka kaunti ya Garissa. Disability is because of polio. I'm polio survivor. I'm also FGM survivor. I'm the founder of a very disabled union group. And the purpose why I formed this group is that I have undergone several serious operations while I was giving birth to my children. It was not caused by my disability, the operations, but the doctor told me it is because of the FGM. And that's why I have started championing for just stopping FGM in Garissa and adults with disabilities. Mimi ndo mwanzaji wa Garissa County Disability Organization. Sisi tuko na sapega nyingi sana hii organization, sababu tumeanzisha hii organization because of tunaona discrimination ilikuwa nyingi sana. FGM inafanyika kwa watu wa disability because wao ndo watu rahisi sana kufanyiwa.
Mbeleni kabla tumuri ijaanza ilikuwa hatuelewi nini inaitangwa ukakataji, nini inaletanga faida gani na inaletanga hasara gani. Tulikuwa tunakata tu sana, tunawaachilia sana, wanaumia mambo inakuwa.
Tangu nilipoingia hii kikundi nimesoma how to stop FGM. Somehow niliona FGM inapata ni wakati kuzaa. Pia anaposhona anatoka na damu sana. So hiyo ni mbaya sana.
We are also very intentional in ensuring that, people who are marginalized, people with various forms of disabilities are brought on board in these conversations. And that way, we say our conversations are inclusive and representative of the different voices in the community.
Every time we have any conversation, we intentionally give people with disability privilege, because most of the time it's very not found within our community, but people who have stigmatization, they don't come out to go for these kind of applications.
Kama sisi, disability is not an ability. Sasa watu wa TGG wanatuinua because PWDs tunaona sasa kama mimi mwenyewe mlinipatia grant. Yani ninajiona kama ninaweza fanya kwenye wale watu wengine wanaweza fanya. The funds has really assisted the people with disability. We are doing the community dialogue, especially mothers with disabilities and the mothers who are doing the cards. And we also do the mentorship forum in deaf special school. What option for 2DD can consider kuambia kwanza thank you kwa kuleta mbele organization led by persons with disabilities. I'm here by encouraging them to apply these funds so that we can do this campaign together. It is good organizations led by persons with disabilities to apply and move together this movement, and we end FGM together.
Thank you very much. That is the end of my presentation. Thank you.
What a powerful way to end your presentation, Jacinta. Thank you so much. Disability isn't inability. And I think the work the Girls' Generation TGG team has done just showed that it is a survival, changing the survival to advocates and making them into change makers. It is research-based, community-supported, capacity strengthened with their own ownership, and the voice and the visibility are there for their voice to be heard and their rights to be met. Thank you so much. This is also another reason why we're doing this kind of webinars. We need to talk to each other, to share what goes well, what needs to be improved. So at the end of the day, this is the same goal, right? We are leaving no one behind, and we want to prevent the harmful practices and ensure the disability inclusion. So thank you so much for that. That being said, we are moving to another side of our webinar today, which will be focusing on a country experience on disability inclusion in the ending child marriage programs. We are honored to have two representatives from UNICEF Mozambique and the UNFPA Mozambique offices, Gaia and Patricia. And our specialists on disability inclusion, Lucy, will be the one who moderates this candid conversation. Over to you, Lucy, Gaia, and Patricia. And if you can turn on your camera, I can spotlight all of you.
Great. Thank you so much. So I understand we don't have presentations, but we will have exciting discussion. So I will pass over to you, Gaia and Patricia. Thank you so much for joining us.
Thank you very much. Good afternoon, everybody. I'm Gaia Seguola, UNICEF Mozambique, Child Protection Specialist. So I will briefly speak about our experience. In Mozambique, the prevalence of child marriage is very high, is 48%, meaning that almost 1 every 2 girls are victims of child marriage. And these harmful practices is mostly found in rural area. And the driver are economic pressure and social and cultural norms. Girls with disability are more vulnerable to be victim of child marriage, but also face greater barriers in accessing protection services. So under the global program to end child marriage, we were able to come up with inclusive solution through community-based program to identify and protect children with disabilities and promote their participation. In collaboration with our partner ICDP, International Child Development Program, we strengthen disability inclusive child marriage prevention strategy through community-based parenting support. So we provide positive parenting sessions to family and caregiver of children with disability to reduce stigma within family and community. Then we provide trainings to technical staff in the field, but also to government social workers at district level in order to for them to be able to identify and support family at risk of child marriage, especially those of children with disabilities. And those girls are then referred to the safe space that are managed by psychologists. And they are provided with life skills session, and we try to improve their self-esteem and also awareness of their rights, including the right to delay the marriage. Then another approach is the training of the child protection community committees. In those training were adapted in a way that also family of children with disability are included and are also referred to appropriate services and to support networks. As a follow-up, then we do with government district social workers on visit in local languages with formats that are accessible also to children with disabilities. And finally, for monitoring community feedback mechanism, we put in place those mechanisms that includes the voice of children with disabilities in a way that help us refining our approach and ensuring relevance and inclusion. In short, this is what we are doing, and I pass the word to my colleagues, Patricia from UNFPA. Thank you.
Yeah, thank you so much. And hi, colleagues and everyone joining the webinar. My name is Patricia Grunberg. I'm a program specialist for gender and human rights at UNFPA Mozambique. And I'm also the disability focal point for the country office. And I will share an intervention that we are doing in Mozambique or implementing in Mozambique with the purpose of improving accessibility of services in the area of sexual and reproductive health and gender-based violence to persons with disabilities. And just briefly to add on also to what Gaia already presented, that we know that women and girls with disabilities are disproportionately affected by different types of violence, including gender-based violence. And it's because of the intersection of gender and disability. And that often means that they are denied the right to make decisions about their bodies, their sexuality, including their sexual reproductive health, which in turn increases the risks of unwanted pregnancies, unsafe abortions, or obtaining sexually transmitted infections. And what we also heard Lucy mention or speak about, so they have an increased need for services, but decreased access because oftentimes GBV and SRH services are not accessible. And that is also the case in Mozambique, where SRH and GBV's response systems, they can lack physical accessibility. There is a lack in service providers that speak sign language or any adapted communication tools, or just staff that are trained on how to meet the specific needs of persons with disabilities. So what we have been doing is that under a joint UN program with the Global Disability Fund, UNFPA, together with our implementing partner IFO, that is a specialized civil society organization on disability inclusion, we developed standard operating procedures for service providers on how to provide inclusive and accessible services. So essentially, it's a set of like a step-to-step guide with recommendation and practical guidance for all the phases of service delivery, from reception to treatment, referral, and follow-up. It also has an operational guide, so it's very, very hands-on, and it has like checklists on how to assess the level of accessibility of the specific service center. And then as a follow-up activity to this SOPs under the UNFPA, UNICEF Global Program to End Child Marriage, we developed a tool or a resource which we call the Argumentative and Alternative Communication Album. And it's developed to facilitate the interaction between a service provider and a person with communication difficulties. So it's also then facilitating the implementation of the SOPs. And when we speak about persons with communication difficulties, that can involve deaf persons or persons with hearing difficulties, persons with intellectual disabilities, and persons that for other reasons are experiencing difficulties in speaking. And it can be, for example, due to trauma, like severe form of trauma. And the tool is developed for service providers, particularly in the area of GBV and SRH, but it could also be used by service providers in other areas. And it was developed by a professional company in Brazil, but we've done several rounds of consultations at the country level to ensure it's adapted to the Mozambican context. We've also done focus group discussions with women and youth with disabilities and with service providers, because when you see an image, how you interpret or what you associate that image with, it's very contextual. It will depend a lot on the physical and social context where you're living. And I actually I have one copy of the album here. I will show it a bit at the end as well. Yeah, so essentially the album has pictures that can facilitate the interaction, and every picture also have captions. So for patients that are literate, that can also help. But we know in the Mozambican context that many of the women and youth with disabilities or communication difficulties, they are not literate. So then the communication is relying more on the pictures themselves. And currently we are in the phase of piloting these resources, and we are doing that under the global program. to end child marriage, and it's implemented in 3 different provinces. And in these provinces, we have selected both a health facility, and that also include a youth-friendly health service center, and these one-stop centers to prevent and respond to gender-based violence. So essentially a center where you can go in and report the case, and then you find health services, you find justice, social action. So instead of you having to go to various spaces or locations to get support, you have everything in one center. For each of these provinces, we are implementing the pilot. We have also recruited representatives from the disability community, so representatives from organizations of persons with disabilities that are supporting and monitoring the implementation. And the pilot phase will end at the end of October. So we are very excited to see kind of the final results or feedback for how the pilot's been going. But we have received some feedback that it has increased the demand for services at these centers. And I think that is also largely due to the work of the persons with disabilities that are working to monitor and support the implementation. And in terms of next steps, so once we finalize the pilot phase, we will hold a validation workshop with government, and then print and distribute these resources at health facilities and GBV facilities next year. And that also include all the target provinces and districts of the global program to end child marriage. Thank you. That's the end of my presentation, or my brief summary, maybe I should say.
Great. Thank you so much, Patricia and Gaia. It's really interesting to hear about the work that's happening directly at country level in Mozambique, and to see all of these things we spoke about earlier in the webinar really coming to life in your country context. So thank you so much for sharing that. I believe we're now up to the Q&A section. Shawa, is that correct? If people have put any questions in the chat, sorry, I muted myself, or if they want to be raising their hand to ask questions. So I'll pass over to you, Shawa. It looks like, Shawa, are you there? She might be a little bit frozen, because it looks like her screen's not moving, but that's okay. So I will say for colleagues on the call, if you have any questions, please feel free to put those in the chat, whether they're general questions or oh yes, it looks like her connection's unstable. So whether those are general questions, or if you have a specific question for any of our colleagues who have presented on the call. So we had the guidance brief, we had Dr. Jacinta presenting on Girls' Generation, and then our colleagues here from Mozambique. So please put your question in the chat or use the raise your hand function. Please feel free to go ahead. And I guess while people are thinking of their questions, perhaps a question I have for you, Gaia and Patricia, is were there any particular challenges that you faced in implementing these programs that you can share with us? Anything particularly challenging, and how you dealt with that? Gaia, go ahead.
Okay, I think the most difficult challenge is identifying those girls with disabilities, because normally the family is ashamed of them, so try to hidden them in the house. So it's difficult. Many times they don't go to school, or they don't participate to community activities. So that's why it's important, for example, the training of the child protection community committees, because those people are members of the community, they know where are those children with disabilities. So once they are aware of the rights of people with disabilities and what the program is, then they call the social worker and tell us where to find the girls. And many times we were able also to prevent the child marriage of those girls, thanks to the call from the member of the Child Protection Community Committee, where we find, for example, community leader are part of this committee, or teacher or health worker, but also children themselves. So normally is difficult to identify, but when they are identified, then what we do, then we do the parenting session to ask the parents to involve the girls to our activities, like the one with the psychologist, all the life skill, the financial literacy, etc. So is every step there is a challenge, but fortunately by implementing we understand the challenge and we find the solution for the next steps. And then another step, another challenge. So for example, for the monitoring or the feedback or the home visits. And then is a continued follow-up that provide us material for learning, reflect and adapt to the needs of the beneficiary we serve. Thank you. Patricia, I don't know.
Thank you so much, Gaia. That's great. Anything you would like to share, Patricia, on challenges in implementation?
Yes, I agree with Gaia, the difficulties of identifying the girls and also attracting them to join the activities that we have on the ground, because maybe if we have programs, for example, with for youth empowerment or mentorship, peer-to-peer mentorship, if they don't see other youth with disabilities, maybe they feel reluctant to join. So one strategy we try to adopt is to actually integrate girls or boys as well, because we do work with mentorship for boys as well, but as mentors, as role models, so that other like young peers with disabilities can identify themselves and see that, oh, this is a space as well for me. And I think that is one important factor. But I would also add maybe the lack of accessible data. From the last census we have, the estimated rate of disability of persons with disability is 2.7%. So everyone knows that it's a vast underestimation, because compared to global estimates, which is 16%. And this is also, I think, a challenge to really raise the importance of having strengthened accessibility of services at all levels, all types of services. It's easier to argue for something when we have robust data that can really prove the case. So that is also one challenge, I would say, at the country level.
Great. Thank you so much, Patricia, for sharing that. And I see Shawa has returned to us. So I'll hand over to you to manage some of the other questions. I see some coming through in chat.
Thank you so much, Lucy, Arunav, and Tim, because yeah, it's I was worried it's gonna happen, but everybody handled it seamlessly. So we have a question from Suvi. Okay, so it's a question either Patricia or Gaia or Jacinta. For you, how to include girls with disabilities in FGM and child marriage prevention in group settings, for example, like school clubs, because that's what they have in their project, but without highlighting their disability and the stigmatizing. Would you prefer to give it a go, Jacinta, first?
Okay, I can start. Because as I said at the start, our program's focus is girls, right? We call the girl generation. That is the focus, which means that we are often, of course, working with schools, right? Very often we're working with schools, therefore working with girls in school. But having said that, we also recognize that girls with disabilities may also not have access to schools. That's also the reality of this work. So one of the, I think, really critical ways of ensuring that you are indeed reaching young women, young girls with disabilities is to be first and foremost working with those organizations who are dedicated to, in other words, they're persons with disability-led organizations that exist. And that's really where we need to go. That's where we do go. That's who we support, because they are able to access girls. They're able to define what the challenges and risks are. They're the ones bringing experience to the table with regards to how we might work with girls and how and where we need to work with girls. But having said that, as I said earlier in my presentation, that even with these organizations, we're still also giving thought to how do we strengthen their capacity to act? How do we place them in platforms, particularly where policy making is taking place, where research needs to happen? How do we ensure that they become part of those engagements? And again, our most critical stakeholder in this, it has often been persons with disability-led organizations, because at least they do exist in the regions in which we are, and where they don't, as you saw with the film, the brief video we showed, they actually, as a result of our intervention, create them. Thank you.
Amazing. Putting girls at the center and also rely on the OPDs, organizations with persons with disabilities. And Gaia also put in the chat about to enable girls or persons with disability with leadership or role model roles. So it's also help fight against the discriminatory stereotypes. Wonderful. Let's move to another question. Katrina asked, maybe Patricia could give it a go, and then Lucy, I also know you have a lot of resources to share at the end. Katrina asked that what kind of research output would be more helpful to inform evidence-based child marriage and or FGM programming for girls and women with disabilities? Patricia? Because yeah, it seems like they're also everybody also impressed with the album tool you mentioned.
Yeah, actually, we're also working on another pilot, and it is actually to have a more accurate estimate of persons with disabilities in Mozambique, where we have selected 2 different districts where we do the methodology of a census, which is essentially to go to each household and ask a set of questions. But instead of how the census was asked in the last round, which was essentially then it was more just asking if there was a person with disability in the household, and then you don't capture. There's a lot of persons that you don't capture, but then there is another internationally recommended way of asking these questions, which is it's called the Washington Group Questionnaire. And then you ask on functionality instead, and then you capture like all the persons with, or a much bigger percentage of the persons that have some kind of functional limitation barrier in relation to their surrounding. So we're doing this pilot now, and then we are seeing figures that are closer to 20% in these districts. So to have actually accurate data on the prevalence and who are the persons with disabilities, where do they live, what kind of disability do they have, that would really help us and inform our programming, because then we can adjust our interventions to that. But to have that, for the whole country. So we are hoping that we might have that from the next census that Mozambique will implement in 2027. But then I think also in general, when we implement programs, to always have as a practice to always capture disability segregation in all the data. That will also facilitate a lot or help us to inform future programming. So that is one step that we are trying to take at the country office level. So not only where we have programs that are focused particularly on disability inclusion, but also in all the programs to have the segregation.
Okay, and to add to what you said there, Patricia, that's exactly what I was going to talk about as well with collecting data. I'm going to put a little link in the chat on the UNICEF Washington Group Child Functioning module, which is the survey tool Patricia was mentioning. And when you have disaggregated data by disability, then it gives you the evidence you need to move forward with your work, and if girls with disabilities are being reached. I would also like to share very briefly some of the key resources that we have that can support disability inclusive programming. So things to do with accessibility and with addressing stigma and discrimination, as well as training for frontline workers on disability inclusion. So I was going to, oh, there it is. Show the slide briefly.
Mm-hmm.
So UNICEF has a few tools. So this one is the accessibility toolkit. So this is really helpful in making sure you've got accessibility throughout your programming. It's got multiple sections, and we can share the link in the chat. The other resource we have is on addressing stigma and discrimination through social and behaviour change. So through our presentations, we heard quite a bit about how stigma and discrimination is a real barrier for including girls with disabilities in such programming. And then we have the frontline workers disability inclusion training. So that's frontline workers of any type to do basic training on disability inclusion. So that's really helpful for building the capacity of workers. And then we also have a guidance on children with disabilities, including them in decision making and programming. And finally, we also have the LAHA website, which is about GBV, so key resource on women and girls with disabilities as well. Thanks.
Wonderful. You see, that's what happens when we put our heads together. There's so many things to share and learn from. Because of the time constraint, we have just one last question, and thank you for those who are still with us. One question from Selmi. It's like inclusion means ensuring that people with disability are part of existing groups working to end child marriage and FGM, rather than creating separate organizations. I think Sam is trying to ask what's the coordinating or collaboration mechanism there, or he wants to know. Yeah. Mm-hmm.
I would just mention briefly what we call the twin track approach to disability inclusion. So what that means is that there's like 2 tracks of programming and work that you do. And so one track is mainstreaming, so trying to bring children with disabilities and disability inclusion into all of your like mainstream regular programming. So doing things like, making sure you're, reading things out loud and providing written information, making sure that things are in accessible spaces so that, people with disabilities can participate in all your mainstream programming. But then we also have targeted programming, and you really need that for when, for whatever reason, the mainstream programming isn't suiting persons with disabilities. So it might be that they need something that's really targeted to them and to their specific, issues that they're facing. And you have that alongside the mainstream programming. So really the answer is that we want to be doing both, and that's the way that we can achieve disability inclusion and reach everybody.
Okay, thank you so much. I think we really get this, comprehensive, and we managed to do it within almost 1 hour. It is always our pleasure to bring everybody together, and thank you so much for our speakers, specialists, and also more importantly, the participants. Being here with us also is a contribution, because we know you also want the same goal, the disability inclusion in the prevention of harmful practices. Thank you so much. We will be sharing the resources and the recordings after, and we will keep having this kind of like webinars and clinics. And please stay tuned, and I hope you are taking good care of yourselves.
Thank you. Thanks, everyone. Bye.
Bye.